Well, good afternoon, everyone. My name is Alberto Pina. I have the honor of serving as the Office of Infectious Disease and HIV/AIDS Policy Region 9 Deputy Director. It has been an amazing 2 days. Yesterday, during my 2-hour commute home from UCLA, which I had plenty of time to reflect on a lot of the innovations and discussions that were shared over the 2 days. They really left me feeling confident that the future holds great promise in ending the HIV epidemic. Over the last 2 days, we heard from leaders, federal, state, local community leaders, academics, who provided perspectives on ending the HIV epidemic. We learned the importance of continuing research and implementing innovative practices to accelerate the epidemic's end. We identified critical best practices through various NIH-funded EHE projects that have reached communities most impacted and at risk for HIV. Some of these projects we heard about highlighted mobile health and testing, social media campaigns to promote PrEP and awareness, and the power of social networks to do outreach and encourage the utilization of HIV services. What I found most exciting is how these projects are really engaging and focusing on our priority populations, including youth, women, and men in our jail systems, whom we unfortunately may forget about sometimes. In our sessions today, we were reminded about the need to push integration of other services to address endemics, and the critical call to bring other federal agencies to the table, provide them an invitation, a seat, such as CMS and HUD, to take the response to another level. Let's all work on bringing these agencies and others outside of the HIV work to the next National Ending the HIV Epidemic meeting. As we conclude our second day, I think our call to action is clear. We must continue to bridge research and community, ensuring that voices in the most impacted communities participate and continue to be at the table to strengthen community academic partnerships. Number 2, as researchers, we must be present, we must be visible in communities we have the privilege to serve, to build trust. We must let the community know we are here to build a partnership. We must also remember to mentor and develop the next generation of researchers to continue the work and share the key lessons in how to work with the community. Number 3, partnerships with non-traditional partners like academia, business, and faith communities have been vital in our response to broaden HIV prevention and testing services outside of traditional settings, to address stigma, to bring awareness of HIV in sectors of society that may not be aware. This remains a critical piece, but we must also continue to make efforts to strengthen and bridge our public health departments with the community to help local jurisdictions respond to the HIV epidemic. Number 4, implementation science is critical. This is important to lower barriers to care, implement successful outreach strategies in the most impacted communities, and connect people needing prevention and treatment services. We need to translate research from theory into practice and continue to create models to accelerate the end of the HIV epidemic in our nation. There is need to translate research faster and to share with our CBOs, state and local health departments who are boots on the ground doing the work. In closing, Commander Sandoval and I are very fortunate to be able to hear from the community voices, community-based organizations, our academic and our leaders and experts in HIV and STI field across the region. Since day one, our priority and mission in the region has been to amplify what we hear to the Office of the Secretary for Health to help inform policy. Over the past 4 years, we have witnessed challenges in EHE and also have seen amazing work and efforts in the HIV response across the country. So rest assured that what we heard these past 2 days, we will amplify to the Office of the Assistant Secretary for Health. As we advance EHE going into year 5, it is important we ask ourselves what is working in the response and what is not. What is the best practices for reaching our communities most impacted, and how can we connect them to care? How can we replicate and build upon innovations we've heard over the last 2 days? Let's evaluate and eliminate what isn't working and consider doubling down on what is working to maximize the response. I'm leaving the conference inspired, and I hope you are also feeling inspired to continue the work and ready to double down. Thank you for all your passion, your commitment, and your grit. Thank you.